Welcome to the DentiMax Tip of the Week. In this week's tip, I want to go ahead and show you how you can put your treatment plan in order and how you know what to schedule out of a patient's treatment plan. So if I jump to our scheduler, we have our patient Jared Martinez here. If I double click on the appointment, you can see in the bottom that there are no service codes attached to this appointment. However, Jared does have a treatment plan that perhaps you're wanting to schedule out from. So here if we click Add from Treatment Plan, you can see that there are several items here in as planned items, but they're all listed under Treatment Plan Option 1. So how would you know which items to schedule first out of this listing? The answer to that is by going to his chart. So we'll go ahead and jump over to Jared's chart, and I'm going to choose to view only my planned items just so we can get those all together. So I'm going to uncheck Completed and Other Doctor. And I'm going to go ahead and hide the odontogram so we can see things a little bit better here. You'll notice that he's got several items here on his treatment plan, and the date to the left of those items is the date that he is actually scheduled to have those done. So we can see a few of these items are actually already scheduled. If I'm the assistant or the hygienist working in the chart for Jared, I want to go ahead and let the front office know which things are our first priorities. So if you'll notice, we have a few items down here at the bottom under the order category that say 1 and 2. We'll go ahead and click on order once again just to move those items up to the top. So you can see our root canal and our placement of implant is the first items out of this treatment plan that need to get done. And then items 2, appointment 2, if you'd like to think of it that way, would be for the abutment and the crown for tooth number 22 to go on that implant. If I have a few other things I want to add to the treatment plan and make it part of order 1 or 2 or session 1 or 2, you can simply select that line item by clicking on it, and where order is listed, you can just type a 1, 2, 3, etc. So if I want to take bite wings as part of the second appointment, I can just type a 2 there, and it automatically puts those 2 bite wings into the system as the second session or second appointment of this patient's treatment plan that we're looking at. If you were to double click on any one of these items, in the bottom right corner of the screen, you'll be able to see that the order number is put here next to session number, and then the treatment plan option is listed as treatment plan option 1. If we go out of that screen, I just want to point out if we go to the treatment plan tab here in the chart, the patient does have 3 different treatment plans listed. If I want to view a different treatment plan and put that treatment plan in order, all I have to do is select that plan, click Load Plan, and we can go back to the charting tab and see that the second treatment plan is for a bridge for number 21 to 23 instead of the implant for number 22. Again, if I select that item where it says order, just go ahead and click a 1. Basically what I'm doing is indicating that all 3 of these items need to be part of appointment number 1. Aside from scheduling the appointment where you'll be able to see these options put in order of use, we can pull up our treatment estimate in our options menu, and currently I had plan 2 loaded, so that's what we're going to see here, treatment plan number 2, although you can toggle between your other treatment plans just by clicking on them here. You'll be able to see in the order column once again, here's the first items and the second items that are supposed to be part of that first and second appointment or first and second session for option 1. If we jump to option 2, there is only 1 appointment or 1 session to be listed for option 2. And we could quickly look at option 3 and see that there's nothing listed in there. So if I close out of here and go back to the patient's appointment and click on Add from Treatment Plan, I can choose up here at the top which treatment plan I want to add items from. We'll go ahead and say Treatment Plan Option 2. I can either left click on an item and drag it down to treatment plan for this appointment and drop it in this space, or I can select the item from here and click my arrow down button and move it in the same fashion. Then we can close out of our screen and see attached to the appointment are those 3 service codes, so the patient will have a bridge instead of an implant there, and we can save our changes. After we've saved those changes, obviously we can see right from here that those 3 service codes were added to the patient's appointment. So we can see the actual abbreviation and then the service codes themselves. And that, of course, helps to communicate from the back to the front office which things should be done as the first appointment of a large treatment plan. Or if you're working with multiple treatment plans, you can grab different items out of different treatment plans. If you have any further questions about today's tip of the week, please feel free to call DentiMax at 1-800-704-8494. Thank you.